the first thing that the mothers asks me is, how is my baby doing? I wish I can be there. I wish I can see her. How can I help these parents? How can I reduce this gap? And the iPad was always there. The FaceTime was always there. But then the barriers were, tremendous. So I wanted to, break all those barriers and somehow connect to the mother with their babies.
Dr. Shaik came to me with the idea to use the iPads for the families to connect with their baby when they weren't able to be in the NICU. We knew we had to have it confidential, and we wanted it to be easy to set up and easy to use. So then we submitted our proposal, and we worked with IT after we got accepted, and we chose the iPad because everybody has a smartphone these days, and we felt that would be easiest for people to use and to learn to use. We loaded a program that we use in telehealth that is the same program that's on the big equipment, but it's a mobile application, and we loaded that on the iPads. IT took everything else off that's on the iPads, so we had them secure. And then once we have the program is able to connect through the Alberta Health Services restricted network, so everything's encrypted, so the family's able to have a confidential conversation and talk to the physician and also see their baby at the same time. So it isn't just a face-to-face with the baby and speaking to the baby, they're able to have that discussion with the physician about the baby's care.
So my due date was December 17th, and then it was the first week in November. My husband actually went on a boys trip to Seattle, and then I think we got to hospital about 9:10. He was born 9:41. So yeah, it was super fast.
Yeah, so I got a text message off a friend saying when you get this to give us a call. It was like 9 o'clock in the morning. I was just like, this is not good. He says, congratulations, you're a daddy. Casey gave birth this morning, and I was shocked. I didn't know what to do.
Because he was a preemie, he had to be checked out and his breathing had to be kind of taken care of. So I went over to NIC unit, and that's when I started rolling in the iPad on wheels. And I said, this is an iPad, and you're actually the first mom, and I brought her to use it. I'm like, oh, cool. The iPad kind of got wheeled in, so I was like on a stand with wheels. It kind of looks a bit like FaceTime. And then I put it to the right side of my bed, and then they kind of dialed in. It was kind of like a phone call. And then I could see Dr. Shaik, Nurse Amber, and then my baby Larkin inside the incubator. And they were like introducing themselves. They were telling me that they're going to check him over. They're going to give him the vitamin K shot. It was nice to see him and to know he's being looked after. And I took a video and two videos, and I sent those over to my family in Germany and to James in Seattle because he only found out that he was born.
She sent on a video link of the iPad video of Larkin, and when they were examining him and everything, and I kind of knew when I saw that, it was like, he's in good hands and everything's going to be fine, Yeah.
It helps with the separation anxiety that moms can certainly have when their babies are taken from them. Can't imagine what would go through a mother's mind, particularly if they've been anesthetized for a cesarean section, and they wake up and they have no idea where their baby is, how their baby is. We whisk the baby away after we've stabilized the baby, and they have no idea what's happening. So this is a way of letting them know that their baby is being well cared for. Mom and dad are not so scared. They know that how their baby is doing. They know that, oh, this isn't quite so bad. Technology is so wonderful, and you can do these things. We knew we could improve the quality of care. And this was one way that we could make a difference in the lives of our parents and in the care of their babies.
And the moment the iPad was switched on, the mother's attention was just right on that baby in the NICU. She wasn't listening. She was not caring what other people were doing there for her. She was not caring about anyone in that room. She was totally glued there to the iPad.
I couldn't imagine being away from my newborn, which waiting for 9 months. I know there's preemie, so it's probably a bit earlier. You can't see the baby because you're sick or the baby is sick, and then that one 100% they need it. Because it's heartbreaking. It's heartbreaking as a mom when you can't see your baby.
I think it's a great team effort. I think everything, a simple idea came around very well, and it's not just the patients. I see the containment in the NICU staff. They feel so happy when they take that iPads and they set it up. Every time they feel, they are part of this wonderful experience. I've seen them cry with the parents. And I think that whole experience of the family and the NSU staff being a part of it and enjoying that moment makes me proud, makes me feel that, we are doing something good, not only for the patient, but for the whole unit, for the whole medical team.
I would like to see it in other hospitals, especially the higher acuity ones, the level 3 NICUs, where you have these babies who are there for months on end. I mean, just to be able to see, even to hear a little squeak from their baby is, brings so much joy to them.
Knowing that you made a difference, and then when they leave, as related to patient experience, they say, it was great, it was amazing, it made it that much better, and if we can make it that much better, that's enough for me.